Welcome to this video. We're thinking about vitamin D again today. Now you get all sorts of people on the internet and on YouTube talking all sorts of rubbish about their pet theories, and they're not worth anything unless they're backed up with evidence. So for the past few days, pretty well exclusively for the past couple of days actually, I've been looking at the evidence for vitamin D and immune function, and I've really become quite convinced by the argument, and it does fit in with a lot of observations that we're seeing. So I'm going to present quite a bit of evidence in this video. Now, if you want to skip it and cut to the bottom line, I'll give you the bottom line now. So vitamin D is necessary for normal immune function. People with low levels of vitamin D will have reduced levels of immunity. And this does seem to predispose them to viral infections and to bacterial infections. We don't get too much vitamin D from our diet. A lot of vitamin D comes from the sun. And in a lot of northern areas, and indeed far southern areas in the world, we don't get enough sun for much of the year to produce enough vitamin D. Therefore, a lot of us are deficient. And the other important point here, and this explains or may explain a lot of the data we're seeing around the world in this pandemic, is that the darker your skin, the more slowly you produce vitamin D. So if I'm in the sun for an hour, I'll produce so much vitamin D. If someone with much darker skin than me is in the sun for an hour, they'll produce less vitamin D, depending on how dark their skin is. The darker, the slower the vitamin D is produced. So this means that people with darker coloured skins are more prone to vitamin D deficiency. And it can also be a particular problem in Islamic women as well, who are covered a lot of the time. So the evidence for taking a supplement of vitamin D, I believe, is strong enough for you to ask your healthcare provider if you should be taking a supplement of vitamin D. And I'm going to start giving you some evidence for that now. Now, just before so you can skip that now. I've told you what I want to tell you. But if you want to stay with the evidence, then that would be absolutely brilliant. Now, just before we start, it's very confusing because there's two ways to measure vitamin D dose, the dose of vitamin D. So there's the international units method and there's the micrograms method. So there's 1,000 micrograms in a milligram and there's 1,000 milligrams in a gram. So 500 international units of vitamin D is 12.5 micrograms, and that's sometimes written mcg, or sometimes this UE squiggle here with the G. That's some Greek letter or something. But that and that mean exactly the same thing. And 1,000 international units is 25 micrograms of vitamin D. So remember that 1,000 units is 25 micrograms, because that does get a bit confusing sometimes. Now, let's get straight down to the evidence. Now, the first line, and all this evidence, of course, I'm going to post. You can click on the links yourself. Make sure I'm not making all this up. This has to be evidence-based. Now, this is from Public Health England, and this is their vitamin D recommendations. So Public Health England are saying, so this is not me saying, this is Public Health England, and click on that link. People should consider taking a daily supplement containing 10 micrograms of vitamin D in autumn and winter. So they're giving a dose. They're advising a dose. And this is a very conservative dose. It's a relatively small dose. So, for example, here's the ones I got from Morrison's. They're the Aldi ones. You can get them anywhere. I get mine from supermarkets. So this is from Morrison's, and this is 90 tablets. They're quite cheap, and these contain 12.5 micrograms. 12.5 micrograms, if you can see that. So 12.5 micrograms is going to be 500 international units in those tablets. These ones are a bit stronger. These ones contain 25 micrograms. So these are twice as strong as those ones, or contain twice as much vitamin D. So 10 micrograms of vitamin D a day. So they're recommending a very conservative dose here. Now, they then go on to say, African, Afro-Caribbean, South Asian backgrounds may not get enough vitamin D from sunlight in the summer. In other words, they're saying, they're being very polite, but they're saying the darker your colour the skin is, the less you're going to make. So even in summertime, if you live in England, especially where I live in the north, or you live in Scotland or somewhere, and you've got dark coloured skin, then you're probably not going to make enough vitamin D even in summertime. Therefore, you should consider taking a supplement all year round. That's the advice from Public Health England. I'm not going to argue with it. Now, it goes on to say children aged 1 to 4 should have a daily dose of 10 micrograms of vitamin D supplement. Now, this is a bit strange. So what they're saying here is children should have 10 micrograms and people, which presumably they mean adults, should have 10 micrograms. So to me, if children are having 10 micrograms, adults would need double that or triple that. But this is their guidelines anyway. So that's what they're saying. Children 1 to 4 should have 10 microgram vitamin D supplement. Public Health England recommends that babies are exclusively breastfed until around 6 months of age. So presumably what they're saying is that below that age, you give the vitamin D to the mother, and then the mother will pass the vitamin D on to the child in the breast milk. And then they go on to say, as a precaution, all babies under 1 year should have a daily 8.5 to 10 micrograms vitamin D supplement to ensure they get enough. So again, they're actually saying here that babies and adults get the same. I don't quite get what they're saying, but anyway, it's not my duty to inform Public Health England how to write their guidelines. That is what they are saying. So this is, to me, is strong evidence that they're saying vitamin D is important, and because they're recommending it nationally, to me that also means that it's going to be fairly safe. It's certainly in those doses that they are advocating, which are low doses. Now, this one was from a nutrition magazine. Not magazine, a peer-reviewed journal. These are all proper journals. Nutrition journal, where nutritionists and clever people like that write in. Now, there's these two things. These are both immune proteins. So these two immune proteins can lower viral replication rates. And these immune proteins can be deficient in vitamin D deficiency. So when there's enough vitamin D, we can make enough of these proteins, and that can lower viral replication rates. And that, of course, is good. It's reducing the rate at which viral particles multiply. It's exactly what we want. And this is interesting. And reduce concentrations of pro-inflammatory cytokines. Now, cytokines are these hormones or these chemicals that one cell uses to communicate with another cell. So one cell communicates with another cell using these chemical cytokines. And some cytokines promote inflammation. So good levels of vitamin D is going to reduce the concentrations of pro-inflammatory cytokines. So if you reduce the amount of pro-inflammatory cytokines, in other words, you reduce the amount of inflammation, which is great. Because in COVID-19, if we remember our alveoli diagram like this, these hollow bunches of grapes, these alveoli, where the air goes in and out. So that's the bronchiole, the air goes in there, we breathe it out there. And the oxygen goes from there into the blood, and the carbon dioxide goes from the blood back into the air to be breathed out. Now, part of the problem with COVID-19 is that people can develop ARDS, acute respiratory distress syndrome. And that is basically an inflammatory condition. So what happens is the alveoli and the airways become inflamed. And they become inflamed because of these pro-inflammatory cytokines. So they become inflamed. And then, like when you sprain your ankle and it gets swollen, fluid comes out. So we get fluid collecting in there. And that means we get what we call consolidation and infiltration in the lungs. They fill up with fluid and therefore they don't work. Therefore the person gets no oxygen in their blood, therefore they can die. It's that simple. So that's how important these inflammatory processes are. So to keep down pro-inflammatory cytokines and infection is usually a good thing. Now, actually, it's complicated. I mean, that doesn't mean to say we should be taking anti-inflammatory drugs. We shouldn't. But for the vitamin D, we think it's a good thing. Now, increasing concentrations of anti-inflammatory cytokines. So we've said that. That's good. Right. Oh, no, we didn't say that. So it increases the concentration of anti-inflammatory cytokines. Right. So it's reducing the concentrations of pro-inflammatory cytokines, and it's also increasing the concentrations of anti-inflammatory cytokines. So both of these effects are going to reduce inflammation, which is good, usually good. Now, another line of evidence is the outbreak occurred in winter, including in China, when vitamin D levels would be lower. And vitamin D deficiency has been found to contribute to acute respiratory distress syndrome. So this journal is saying that there is empirical evidence for that theory that we've just sketched on the diagram there. And the case fatality rate increases with age and with chronic comorbidities. So in COVID-19, we know that the case fatality rate, the number of people that die, goes up with age and goes up with other diseases. And both of these, other diseases and increased age, are associated with lower concentrations of vitamin D. So I'm not saying the vitamin D is the only factor. Of course it's not. The other disease and the increasing age are factors. But nevertheless, this study by these nutritional people is saying that vitamin D deficiency is more common with increasing age, and vitamin D deficiency is more common in people with comorbidities. So that kind of hangs together. So carrying on with the same article, to reduce the risk of infection, it is recommended that people at risk of influenza, so they're saying that people with low levels of vitamin D are at risk of influenza and COVID-19. Now, this is not me talking. I do not prescribe. Don't copy me. But these people are saying from this journal, and look it up for yourself, consider people at risk should consider taking 10,000 international units, which is that'd be 250 micrograms, wouldn't it, of vitamin D3 for a few weeks, to rapidly increase the vitamin D concentrations in the blood. And then they're saying 500 international units a day for maintenance dose. Now, don't take medicines, well, supplements on my advice. See what your own doctor says. But that's what these people are saying in this reputable journal. Now, that brings up the point of D2 and D3. Now, this is D3 in here. This doesn't say, but it will be D3. So very often D2 comes from vegetable sources and D3 comes from animal sources. So both will raise the amount of vitamin D in the blood, but D3 does it more effectively. So supplements normally contain D3. Don't get confused about that. And they're saying, that the people in this nutritional magazine, the goal should be to raise the amount of vitamin D in the blood. And there's two ways you can measure it, nanograms per mil or millimoles per litre, and they're presumably the same, and they're the concentrations that they want. So doctors can measure the blood to see how much vitamin D is there, although very rarely they do. But they're saying that that should be the aim. So that's what these authors are saying. They're advocating way higher doses than Public Health England. Now, for the treatment of people who become infected with COVID-19, higher vitamin D doses might be helpful, is what they're saying. Now, we will look at another study later on from the University of Arizona, and that actually says the opposite. Anyway, you don't need to worry about that because the doctor treating you would worry about that if you were ill with it. So we don't have to worry about that. We're talking about preventing it. And the evidence we've looked at so far is indicating that people that are lacking vitamin D are going to be more at risk. People taking supplements of vitamin D are going to be less at risk. Right, prevalence and correlations of vitamin D deficiency in US adults. Now, this comes from three sources. Two of them are the Healthline, which is a reputable site, and I put those links there. And it also comes from a peer-reviewed journal article there as well. Now, just get this. This is powerful. I have mentioned this before. 42% of the US population is vitamin D deficient, according to this study. However, this rate rises to 82% in black people and 70% in Hispanics. Now, who has been suffering most from COVID-19 complications? African Americans. Who has the highest death rate from COVID-19? African Americans. Who is most likely to be deficient in vitamin D? This data tells us African Americans. Now, this is not proving causality. This does not prove that the increased fatality rate is caused by lack of vitamin D. It's a correlation. It's not evidence. It's not causal proof. But it's a pretty good correlation. And given that it's relatively safe for most people to take vitamin D, it would be a variable that would be very interesting to get rid of. And I've mentioned this before, but what concerns me is when this first came out, the fact that African Americans were dying more than white Americans, people jumped to socio-economic explanations. Now, I'm not saying there's not validity to that. There is. People also jumped to saying, well, black people might be drinking more, smoking more, and taking more drugs. Now, I don't know if that's the case or not. But I do know from this data, this is what we know, not what we're speculating about, the evidence from these publications is there. A lot of black people and Hispanics who aren't white but aren't as dark as African Americans don't seem to be making the vitamin D. So that's what these journals are saying. Every cell in your body has receptors for vitamin D. Now that's what the study said. I didn't know that myself. I knew immune cells did, but they're saying every cell in the body. I'm not convinced about that, but that's what they're saying anyway. I'm just quoting what they're saying. This vitamin is involved in many processes, including, well, certainly bone health, because lack of vitamin D has been known for years to cause rickets. Immune system function, that's true, and protection against cancer. So, for example, I'm aware of research that says that people with enough vitamin D get less colon cancer, for example. Right. Good dietary sources include fatty fish, fish oils, egg yolk, butter, and liver. So, yeah, that's true. And especially liver from, well, I was going to say liver from carnivores, but that contains so much vitamins you don't want to eat those. So the Inuit, for example, don't eat polar bear liver because it contains so many fat-soluble vitamins. Fat-soluble vitamins A, D, E and K, the ADEC vitamins. So you don't want too much vitamins A and D, and I don't think you want too much K either. Anyway, that's where it comes from in the food, but many people don't get enough in their diet. And you get it from the sun. So the idea is here to get sun exposure but not get burnt. Now, there's been so much paranoia lately about melanoma, with some justification, but melanoma's cause is overexposure to the sun, especially sunburn in children can be more prone to melanoma in later life. So sunburn is a risk for skin cancer, whereas sun exposure makes lots of vitamin D. Right, this paper, so we're talking about this paper now that you can look up here. If you take vitamin D supplements, make sure not to exceed the safe upper intake level, which is 4,000 international units per day for adults. Now, clearly that is contradicting the previous paper. I suspect this one is closer to the mark, and this is closer to the Public Health England. So what I'm going to do is I'm going to let you into a secret now. These are 25 microgram vitamin D tablets, and I was taking one a day, and I'm now taking 2. So personally, to try and reduce my risk of viral infections, I'm taking 2. I'm taking 50 micrograms a day. Not telling you to do that. That's what I do. But this is saying don't take more than 4 of these a day, is what this is saying. And again, I think they're being fairly conservative here. You do see people recommending high doses, but that is the report from this particular research paper. So remember that I'm taking 2 of those a day. I think I could take more, but that's what I'm taking just now. According to the US Institute of Medicine, the recommended daily allowance is 400 to 800 units. That's 10 to 20 micrograms. But common supplement doses range from 1,000 to 2,000. In other words, 1 or 2 of those per day. And that sounds reasonable to me. And still in this same article, furthermore, vitamin D deficiency has been linked to several cancers. So again, linked to several cancers. Yeah, I knew that. Type 1 diabetes, there's a correlation. Multiple sclerosis, there's a correlation. I knew that one. High blood pressure, I knew that one. Thyroid problems, I didn't know that, but I'll take their word for it. So quite a few disease processes here linked to lack of vitamin D. Now, the reason I became convinced of this is that vitamin D is the only advantage I know of being white. So when people started migrating north, they developed white skin to make more vitamin D. Because if you're living in Africa, you want dark skin if you're out in the sun all day, otherwise you're going to get totally sunburned. But when you migrate north and you're not making as much vitamin D from the tropical sun, having white skin means you can make more vitamin D. So this is a study from Ireland. So the Irish health people, sponsored by the Irish government, I believe, did quite an extensive study on this. So vitamin D is essential for bone and muscle health, yet we knew that. Vitamin D may help prevent respiratory infections in those who have low vitamin D levels. So the Irish are saying here that if you've got low vitamin D levels and you bunk your vitamin D levels up, that may help prevent respiratory infections. So very clear language here from the Irish community health people, which is good. Vitamin D is seasonal and cannot be made during the winter time, while the amount in summertime is subject to sunshine, weather and other factors. Now in Ireland it rains a lot of the time, as it does indeed in Cumbria where I live. So even in some summers you don't get a lot of sun. So winter time for sure you're going to be deficient. Summer you may well be deficient as well. Especially if you have got dark coloured skin and you live in England, then you're likely, well, you will be deficient almost certainly. 47% of adults aged 85 are deficient in winter in Ireland. So in Ireland, older people, half of them are, virtually half are deficient. 27% of those over 70 who are cocooning are likely to be deficient. So very often older people don't go out in winter. Who can blame them? 1 in 8, 13% of adults over 55 are deficient. So a smaller amount. I don't know what the Irish government were taking as their normal levels. That would have been interesting to check. Because really, you could spend a lot of time arguing what the normal levels are. Now, the government in Ireland are giving the same recommendations as Public Health England. 10 micrograms of vitamin D, which is 400 international units. Remember, 12.5 micrograms was 500 international units, is the minimum recommendation during winter time by the Irish government. So they're recommending at least that. That's the minimum that they're recommending. Between 5 and 20 micrograms recommended for most at-risk groups. So presumably that's these groups that are cocooning and to keep out of the rain. So interesting. They're recommending basically one of those a day. I'm taking 2. They're recommending 1. Vitamin D increases production of anti-inflammatory molecules. So again, the Irish health people have looked at this and come to the same conclusion as me, which is always reassuring, of course, and decreases the production of pro-inflammatory molecules. There it is again. So vitamin D increases production of anti-inflammatory molecules, decreases production of pro-inflammatory molecules. Therefore, it can reduce the likelihood of these inflammatory reactions. And the worst inflammatory reaction that you've probably heard of are these cytokine storms that, of course, can kill you with this sort of septic presentation. And in fact, the Irish say that, look, therefore potential benefit in case of cytokine storm. This life-threatening complication of infection caused by massive inflammatory changes. Cytokine storm can lead to ARDS, as we've said. It's nice to see that they're agreeing. That's good. Risk of respiratory infection. Now they looked at they're quoting a study here of nearly 19,000 people. So that's a very good sample size. So in this large sample size of nearly 19,000 people, what they found was that lower levels of vitamin D. So the risk of respiratory infection increased with lower blood levels of vitamin D. So the lower the blood levels of vitamin D, the higher the risk of infection. That's pretty straightforward. That's their conclusion. With lower blood vitamin D levels, and the effect was even stronger in those with underlying lung conditions. So people with like chronic bronchitis or emphysema or chronic obstructive pulmonary disease, For them, if they were deficient in vitamin D, they were even more likely to get respiratory infections. Many case-controlled studies reported associations between low vitamin D and increased risk of infection generally. So more infection generally there. Supplementing patients at risk of respiratory infection with 1,000 international units, that's 25 micrograms of vitamin D a day for a year, reduced symptoms and meant these people needed less antibiotic treatment. So they didn't need to resort to treatment with antibiotics. And it's always good, of course, if you can avoid antibiotics, if at all possible. Vitamin D supplement, this is in a study of nearly 11,000 people, helped to prevent colds, flu and chest infections. Well, there you go. So they're quoting a study here of 11,000 people, nearly 11,000 people, and they found out it helped to prevent, I like that word, prevent. Prevention's better than cure. Prevent colds, flu, chest infections and acute respiratory infections, ARIs. That was just their reference for that. Look it up in the paper, you can check it yourself. It's actually really good, this Irish study. It's like a pamphlet and you can download it. Free. Risk of having at least one acute respiratory infection was reduced from 60% to 32% by correcting vitamin D deficiency. So, do you want a 60% chance of getting infection? Or do you want a 32% chance of getting infection? I know which I want. I want the 32% chance. I'd like it to be lower, but it's certainly better than the 60. So, 60% chance of infection with low vitamin D levels. Vitamin D supplements, 32%. Reduced chance of acute respiratory infections. The study authors conclude that taking a vitamin D supplement was safe and can help protect against acute respiratory infections, particularly if baseline levels are low. So the people that are going to benefit most from taking vitamin D are those that have low levels already, such as African Americans, such as Hispanics in Americans, such as 42% of Americans generally, such as me as well. Low blood vitamin D levels had a 64% increased risk of community-acquired pneumonia. So that's CAP. Get lots of people in A&E with CAP, community-acquired pneumonia. It's basically a pneumonia that people contract when they're at home as opposed to one they contract in hospital. The Irish conclusion. Therefore, maintaining a sufficient vitamin D status in the adults is beneficial in preventing of acute respiratory infections and may therefore be a benefit in preventing the COVID-19. Now, does this prevent COVID-19? The Irish authorities are saying they don't know. Do I know? No, I don't know. The studies haven't been done in COVID-19, but they have been done with other types of chest infections and they have proved to be efficacious. Therefore, it is likely, in my view, that people with low levels of vitamin D would be more prone to COVID-19 infection. Now, there was this. I started prepping this and it went on for ages, so there's a few other references I'll put there. I knew this would just last too long. Now, the only cautionary note I'm saying here, University of Arizona. Now, they say many people are deficient in vitamin D and supplement with this vitamin to become sufficient. Vitamin D sufficiency is an important part of optimal immune function, bone health and brain health, so that's good. So we agree with that. But they did go on to say that people who have the infection should not take vitamin D at the time, which I know contradicts previous studies, so I don't know the answer to that one. But everyone seems to be agreeing that, from the evidence we've looked at, that people who are short of vitamin D are more at risk of respiratory infections. And in my view, this could be one of the main explanations as to why African Americans are suffering disproportionately compared to white Americans. And I just hope the American authorities take this up and run with it, because it's a simple thing to correct. So there we go. That's a load of evidence. It's not just my opinion. Look at the evidence for yourself. Come to your own conclusions. We really need to correct, if there are factors which are reducing immune function, and we correct those factors, and that makes us less likely to get COVID-19, then in the next few months, this potentially has the potential to save so many lives. Really, let's get clever people to work out if this is right or not and make it public health policy. But only governments can do that. So let's hope they get their act together.